I'm Bill Kinney. I'm a runner. I'm a non-smoker. I've never smoked a cigarette in my life, and I've had lung cancer.
We were talking about preventive health issues and how you prevent disease, which is always important to try and prevent an illness before it takes place. And I talked to him about doing a calcium score to look at his coronary arteries to find out maybe if he had any plaquing. And if he did, then we would intensify measures like lowering cholesterol, exercise, and things like that.
The test itself, from sort of start to end, takes about 2 minutes, 3 minutes maybe. We have the computer within the CT synchronize the acquisition of the images to the EKG and the pattern of the EKG. Patient holds his breath. The exam itself takes about 8 seconds of holding breath. The way that we do the images, now it certainly includes the heart, it includes the blood vessels, you can see the calcium, but we can see the lungs around that portion of the heart.
My calcium score was low, and that was great. The doctor and I were both pleased about that. However, as part of it, they noticed that I had some nodules on my lungs, and they also saw something that they were concerned about and wanted to watch, which was a lesion or a growth on my lung.
Much to everybody's surprise, there was something else found, and I'm glad we did the procedure because we found what turned out to be a cancer.
We've probably done a total about 12,000 patients with this study, and I know, certainly I know for a fact that we've diagnosed more than 10 operable lung cancers, because in that portion of the lung, the patient's lung cancer was there.
If it wasn't for the finding there, external to the heart, we hadn't found those little abnormalities, we would have never followed up on this test and found the cancer, which was, eventually resected and cured the cancer and saved his life.
I feel very lucky about it. I feel lucky they found it. I feel lucky that I've had this connection with university hospitals, because the surgeons are wonderful, skillful. It's great to have a good health team to work with, and that's what I love about UH.
The key is being thorough, and the key is seeing data that the patient has generated on testing, and say to yourself as a physician, that's not 100% normal, and we really need to follow up on it. You really can't overlook things and take it for granted that it's nothing, and you just need to be a thorough doctor. That's what it comes down to.